Alright, so this is going to be a sympathetic lump test. This is going to be testing for sympathetic tissue in the case that a patient is getting, let's say, sweating, the iconic headache that they would get around the head like a hat, or if they're getting that glove and stocking syndrome. So what we're going to be doing today is first I'm going to go ahead and have you bend this knee for me. Good. I'm going to have you put your hands behind your back. In this case, this is going to be for his left leg. In a real life situation, I would go ahead and test the right side first, but for the purposes of this video, I'm just going to go straight to the left leg. So from here, I'm going to have you go ahead and slouch. Use really bad back over, and I'm going to let that head go as well. Like this. From here, I'm going to put my hand on the back of his head here. A little bit of overpressure, and then from here I'm going to have him straighten out his leg, and I want you to let me know if this reproduces the symptoms that you've been having. So go ahead and straighten that leg out. And are you getting reproduction of symptoms?
There.
Right there?
Yep.
Okay, so then I want you to look up and tell me, does that make it better or worse?
I feel better.
You feel better? Perfect. So that is going to be a positive for this case. From there, we know that he's having a sympathetic problem in his thoracic spine. And that's something that we can work on from there. Alright, so this is a femoral nerve test. So this is going to be testing for any traction on the femoral nerve. So in this case, let's say that the patient is having left thigh pain. You may test the right side first, but moving forward to the leg that is actually having the symptoms here, I'm going to go ahead and have you lay it onto your right shoulder. Oh, yes. Good. And what I'm going to be doing here is I'm going to be stabilizing at the pelvis.
I'm gonna need that soon.
And now I'm going to be raising this top leg here. I'm going to be pulling him into an extension through the hip. And then from here, I'm going to be bending the knee and looking for a reproduction of symptoms as I'm bending that knee. So if he does say that he has reproduction of symptoms, whether it's in pain or numbness and tingling, that's going to be a positive for the femoral nerve test. Okay, so this is going to be an anterior spine instability test. So in the case that I suspect some instability at, let's say, L4, L5, what I'm going to do is I'm going to have the patient inside lying as such. I'm going to have them bend their hips to about 70 degrees, so he's about in the right position here. Our knees are going to be about 90 degrees. And then from here, what I'm going to do is I'm going to come to the iliac crest. I'm going to come posterior, find my L4. I'm going to stabilize here at the superior part, so the L4 if you're suspecting L4, L5. And then next what I'll be doing is I'm using my hip and my stomach to actually push his legs backward. This is going to be a posterior glide, but L4 relatively is going to be an anterior glide. So what we're going to be looking for is either feeling a clunk or getting a reproduction of symptoms or heaviness in the legs. So I'm going to push forward. And are you having any reproduction of symptoms or any heaviness in the legs?
Yes.
Yes. So in that case, it's going to be a positive test. And in that case, we do know that there's some instability there. Okay, so today we're going to be going over the posterior instability test. So this is going to be looking for an instability. Let's say that I'm expecting, or I found that he has some instability at his L3, L4 segment. So in that case, I'm going to have him sitting on the edge here. What I'm going to have him do is I'm going to have him wrap around me here. Come here. I'm going to find his iliac crest. I'm going to come around to his L4. I'm going to stabilize here. And then what I'm going to do is I'm going to have him actually push his elbows into me. And that's going to create a posterior glide of L3 on top of L4. And does that reproduce symptoms?
Yes.
Okay. So in the case that it does either reproduce symptoms, causes pain again, or there is like a clunk in that L3, L4 region, that's going to be a positive test. And that is all. Okay. So today we're going to be going over the quadrant test. So what we're looking for here is a facet dysfunction or an instability. So this is going to be very helpful in the case of, let's say we brought our patient through a full flexion, full extension, but we're still not getting a reproduction of their symptoms. This is another thing you can add in to help you get down to the bottom of it. So what I'm first going to do is I'm going to have the patient look at me while I do it so he can see how he can do it. So patient, I'm going to have you start with your one hand back here, and we're going to come down our leg, and I want you to let me know if there's any reproduction of your symptoms. We're going to do the same thing on the other side afterwards, and same thing, let me know if that reproduces any of your symptoms. So our patient's going to go through the motion.
Yeah. Oh, that hurts.
And he's having reproduction of symptoms there. That is going to be a positive test. And he's okay on that side. So that means that he has having a right quadrant test positive. So that's going to be significative of a facet dysfunction or joint dysfunction. All right, so this is going to be the Milgram's test. So this is going to be testing for joint dysfunction. For this test, what we're looking for is a reproduction of the patient's symptoms. So what I'm going to do in a second here, I'm going to have you raise your legs here about 5 to 10 centimeters off of the table. I'll assist you with that length. And then we're going to try to hold that for 30 seconds. In the case that he's not able to hold it for 30 seconds, that is a positive. Or if he has a reproduction of his symptoms, that is also considered a positive. So I'm going to lift you up to about where you're going to go. And I want you to hold right here for 30 seconds for me, okay? So you'll be asking again, if you have any reproduction in symptoms, just let me know. So then he drops within 30 seconds, and that will be considered a positive test. Alright, so this is going to be the 90-90 straight leg raise test. This is going to be testing the hamstring length. You can be doing this test whether you suspect a hamstring length insufficiency, whether there is a lumbar or a thoracic pain, or if there's another lower extremity pain that may be linked to the hamstring. So what we're going to be doing for this test, normally you're going to do this on both sides. For the purposes of this video, I'm just going to do it on one side. So I would be bringing my patient up to a 90-90 position, meaning his hip is going to be in 90 degrees of flexion, and his knee is going to also be in 90 degrees of flexion. I'm going to stabilize the hip here, but I'm going to raise the knee, putting him into more knee extension. And what we want is for him to get up to within 20 degrees of full knee extension. In this case, this is as far as he goes, so this is actually a positive for this, meaning that his hamstrings are tight. And again, I'll continue to test the other side, and that will be all. Okay, so today we're going to be going over the Ober's test, or also known as the IT band test. We're going to have our patient in sideline, and in general, I'm going to be testing this on both sides. For the purposes of today's video, I'm just going to be using one side. So we're going to keep our knees bent like so, and our hips are slightly bent. I want almost all of his weight on the trochanter that he's laying on. I'm going to make sure that he keeps rolled over a little bit here. We don't want him to come backwards. We don't want him to roll backwards towards us. So from here, I'm going to be stabilizing at the ilium, applying pressure downward. I'm going to be taking his leg here. And what we're going to do is pull up. We're going to pull tight to keep the IT band tight. And once we get to the full extension, we're going to drop down. And look at how far the leg will go. So in this case, his ankle is getting down to the table, which is a negative test. In the case that it was higher up like so, that's going to be a positive test, meaning that the IT band is tight.
I would rather.
Okay, so today we're going to be going over how to do the Thomas test as well as the rectus femoris test. In this case, I'm going to be kind of rolling the two of them into one. I'm going to show you how to do that. So first, we're going to have our patient standing at the edge of the table here. We're gonna set the table up so that she is able to fully get her fanny on there and support. So I'm gonna have the patient go ahead and come back, and as she goes back, she's gonna roll onto her back. She's gonna grab onto one of her knees here, and she's gonna pull it close to her chest. So in this case, I'm gonna have you actually grab this knee, okay? So she grabs on here, she's holding tight. This is gonna pull anteriorly. I'm gonna have this opposite leg. I'm gonna find the ilium on the opposite side here, and I'm gonna stabilize. I'm gonna push and stabilize. So from here, I'm gonna keep the knee bent. I'm gonna come down, and what I'm looking for is for the thigh to come all the way down to the table. So in this case, you can see that the thigh is still a bit up, so that is a positive so far. We're gonna come out, and this is gonna take slack off of the rectus femoris, and this is going to be our Thomas test. So in this case, she drops down, so that's going to be a negative for the Thomas test. And then if I go back into that knee flexion, that should pop up if the rectus femoris is tight. So I'm going to bend the knee again, and as you can see, the knee or the leg tightens and goes back up. So that is a positive for the rectus femoris. Okay, so today we're going to be going over the sign of the buttock test. So in the case that we've gone through an examination and we still haven't found out what is going to reproduce our symptoms, this is another test that we can do in an attempt for that. So what I'm going to be doing, let's say that the patient has right side pain. Normally I would test the asymptomatic side first. After that, I'll switch over to the symptomatic side. In the purpose of this video, I'm just going to shorten it and go straight to the right side. So what I'm going to be doing here, patient, is I'm going to be straightening your leg, have like a passive straight leg raise test. I'm going to come up, and she says about right there is about where she can go. So what I'm going to do from here is I'm going to keep the hip in the same amount of flexion, but I'm going to allow the knee to flex and take take the tension out of the hamstring. From here, I'm going to be going as if I'm trying to go for more hip flexion. So in the case that she is able to go into more hip flexion, that's going to be a negative test. But in the case that we were starting here and she couldn't go any more, that is a sign of something bad that we're probably going to have to refer out to. That could be something such as neoplasm or a fracture. So we are going to refer out immediately. Okay, so today we're going to be going over a sitting arm lift test. So this is going to be something that we can use if we're suspecting that there is a thoracic instability. So let's say that I found that the T6 level seems to be a bit unstable through joint play or whatever it may be. In this case, what I'm going to do first is I'm going to have on the uninvolved side, she's going to go ahead and raise with her thumb up. So you're going to be here. We're going to come all the way up like so. And that should not reproduce any of her symptoms if that's the uninvolved side. Then we're going to go ahead, come down. We're going to do the same thing on the other side, thumb up, come all the way up. Go ahead and come down. And as I'm normally going to be back here looking for the scapulothoracic motion here, looking for any lack of control that she may have. Did you have any reproduction of symptoms when you raised that arm? No, okay. So go ahead and do this arm again here. And I'm looking for this. Let's say that I saw the lack of control. Go ahead and come back down. So let's say that I saw the lack of control. What I'm going to do now is I'm going to provide stabilization to that thoracic segment that I think that there's going to be some instability in. And we're going to go through that same motion again. And what we should see is that there is no change. But in the case that it is a positive for instability, you're going to see that either the symptoms are less, so she's not going through as much pain through symptoms, or the thoracic motion is actually going to improve once the stabilization is provided. So I'm going to come here. We're going to do the same thing. Go ahead and raise that right arm with your thumb up. Good. Go ahead, come back down. Good. So in this case, it looks the same either way. That's going to be a negative, but again, if there was a change in her symptoms or a change in the scapulothoracic motion, that is going to be indicative of a positive test. So next, we're going to be going over a stability test for the thoracic spine. So again, if we're seeing any, we have any suggestion of a instability in the thoracic spine, this is a test that we can do. So what I'm going to do is I'm going to have you bring this left arm up at about 45 degrees from your body here. And what we're going to do is have her raise it as high as we can. And if this, for example, causes a reproduction of her symptoms, then that is something that we need to test next for with some stabilization. Another thing you can look for is the scapulothoracic motion that you're seeing while she's going through that range of motion. So go ahead and relax this arm. And what I'm going to do now is I'm going to provide thoracic stabilization. And then we're going to go through that same test again. So go ahead and raise your arm. And let's say that her symptoms have decreased from having that stabilization, then that's going to be a positive for the test. Similarly, if before she had a lack of control in her scapulothoracic motion, and once I provide that stabilization, she has more control, that is also going to be a positive test. Okay, so today we're going to be going over what's called the reflex hammer test. So this is going to be a test if we suspect that there's either a vertebral fracture or some sort of trauma that's going to cause a fracture. So let's say that I find the segment of the thoracic spine that I am suspecting is going to have a fracture of some sort. I'm going to go down to that segment. Let's say it's here. What I'm going to do is I'm going to take my finger here, place it onto the spinous process of that vertebra, and then I'm going to take my reflex hammer and give a good tap onto my own finger. In that case, once I hit it, if that shock causes a reproduction of her symptoms, then that is going to be a positive for the test and may be significant of a vertebral fracture. In the case that she doesn't feel any pain during that, that's going to be a negative. Okay, today we're going to be learning Murphy's percussion test. So what this is going to be is a test if we're not finding any mechanical pain. We were suspecting that it may be something else. This is going to help us to rule out that it may be a kidney issue or a urogenital issue. So what we're going to do is we're going to palpate down until we find the 12th rib. And then we're going to come to the costovertebral area here. We're going to cup around with our hand, and we're going to make our other hand into a fist, and we're going to give a good tap. This is going to give a little bit of shock to the kidney, but if this reproduces the patient's symptoms, then that's a positive test, and that's a bad sign. We need to refer out. So here, did that reproduce your symptoms? No. That's a good thing. That means that it's a negative. She's not having a kidney issue there, so we're able to rule that out.